Welcome to your 2016 Open Enrollment session. All full-time employees hired on or before October 31st, 2015 will be making their benefit elections for 2016 during the month of November. This presentation is to inform you of the benefits you are eligible for so that you are educated in making your online elections. This year, Goodwill Central Texas has seen a lot of change, but one thing that isn't changing much are your benefits. We are pleased to announce that there are minimal changes to the plans and employee costs this year. As a result of the premium increase on the medical plans, some adjustments were made, but your deductions for these plans have very minor changes. Goodwill is absorbing most of the cost increases. To your left, in the Attachments tab, you will find the benefits guide as well as the wellness exam and tobacco forms that you will need to submit. Now let's get started. Today, we will be covering information about who to contact for benefits-related matters, open enrollment facts and deadlines, important reminders about the Affordable Care Act, each of the employee benefits you are eligible for, and their changes, and finally, what your next steps and action items will be. Your contacts at Goodwill for benefits are Cindy Adams and Scott Bingham. Your contact with our broker is Sandra Quintanilla. You are encouraged to contact Sandra whenever you have specific claims-related issues with any of the carriers. These contacts, as well as the contact information for each of the carriers, can be found in the Benefits Guide, which is located in UltiPro, and also in the Attachments tab of this presentation to the left of your screen. I encourage each of you to review the full 2016 Benefits Guide, as it contains more detailed information about each of the benefits, as well as legal and compliance notices. Your open enrollment session starts on November 4th and will end on November 22nd. All full-time employees must make their benefit elections online in UltiPro no later than November 22nd. Otherwise, you will have to wait until next open enrollment at the end of 2016 to elect any benefits. After you make your online elections, no changes can be made to your elections until next open enrollment unless you have a qualifying event. As a reminder, in 2014, a law was passed that requires all Americans to have qualifying health coverage. This is called the Affordable Care Act. Examples of qualifying health coverage would include employer coverage, Medicaid, Medicare, TRICARE, VA, CHIP, and some private health coverages. If you decline the medical coverages we are offering you and you do not have any other qualifying health coverage in place for 2016, you could be subject to a tax penalty of $695 or 2.5% of your annual income, whichever is greater. The Affordable Care Act has a website located at www.healthcare.gov where you can view their marketplace to shop for coverage, as well as determine if you are eligible for an exemption to avoid the tax penalty. We will now go over the specific benefits each of you are eligible for, starting with the medical plan. The medical plan is offered through United Healthcare, and you have 2 HMO and 1 PPO plans to choose from. The rates shown on the next slide will be coverage for yourself only. If you wish to add a spouse or domestic partner or children to your medical plan, please refer to the Benefits Guide for those rates. United Healthcare has a great app for those who have a smartphone, and I encourage you to download the Health for Me app. This app allows you to search for in-network physicians and facilities, download your member ID card, and many other things. As a cost savings, United Healthcare offers a mail order program for those who are on maintenance prescriptions. This is no longer required, but is still an option. The copay for mail order 90-day supply prescriptions has changed to 2.5 times the 30-day supply copay. As an example, if your copay for a 30-day supply at the retail pharmacy is $10, your copay for a 90-day supply through mail order will be $25. Also, $5 over-the-counter prescriptions are no longer permitted to be filled through the mail order program. On the next slide, we will be touching on the high-level differences between the three different medical plans, but you are welcome to review the benefits guide for more detailed information on what each plan covers. The three medical plans you have to choose from are the base plan, the mid plan, and the buy-up plan. The employee cost per paycheck for each plan is located on the first line. The employee costs of the plans have minimal changes. The sections on this chart that are highlighted in yellow are the plan changes for 2016. As an example, the deductible amount of $5,000 for the base plan did not change, but the deductible for the mid plan was raised to $2,000 and the buy-up plan deductible was raised to $1,000. As a reminder, these changes were made as a result of the premium increase Goodwill received. Also, keep in mind that you will only have to pay the deductible for major medical issues, such as hospitalization and inpatient or outpatient surgery. The copays for doctor visits, as well as the coinsurance amounts, did not change. Wellness visits, as well as labs and x-rays, also continue to be covered at 100% and are not subject to a copay nor deductible. One change was made to the prescription plan, and that was adding a fourth tier to the plan with a $100 copay for that tier level of pharmaceuticals. These are typically your new and very high-cost prescriptions. Your ER and urgent care copays also remain the same. The last change to the medical plans is that your coverages for the base and mid plans no longer cover out-of-network physicians and facilities. If you choose to go out-of-network on these plans, you will be responsible for 100% of those medical costs, and United Healthcare will not assist you in negotiating reduced costs. In case of emergencies, all services and treatments will be billed as in-network. You can still go out-of-network for the buy-up plan, but please remember that those medical costs will still be at the higher rate than if you stayed in-network. As always, please contact United Healthcare to determine if your physician or facility is in-network. Everyone matters at Goodwill, and your health is equally important to us. Therefore, we offer cost incentives for the medical plans as long as you obtain a wellness exam and are not a tobacco user. The wellness exam is no cost to you as long as you present your United Healthcare member ID card and visit an in-network provider. Getting your annual wellness exam is a way for you to be on top of your health and proactively taking care of any health issues. The quickest way to obtain your wellness exam is to visit your local CVS Minute Clinic. We encourage tobacco users to quit prior to January 24th in order to get the cost incentive, and Goodwill will also provide you with a $200 bonus after 90 days being tobacco-free. If you are currently on the medical plan, you can also utilize the Advanced Tobacco Cessation Program called Quit Power, free of charge through United Healthcare. Wellness and tobacco user forms can be downloaded from UltiPro and also will be mailed to all employees who elect medical coverage. If you are a tobacco user and/or do not receive a wellness exam by January 24th, your medical rates will increase effective February 1st. Dental coverage is offered through MetLife, and there are no plan nor cost changes for next year. The dental plan provides $1,250 of coverage annually with a $50 deductible per member and a $150 maximum deductible per family. The benefits include preventative treatment covered at 100%, basic treatment covered at 80%, and major treatments covered at 50%. As a reminder, always contact MetLife to confirm that your dentist or provider is in network. If you are not currently on the dental plan and decide to elect this during open enrollment, you will have a wait period of 12 months for Type B and C treatments. The Vision Plan is offered through VSP, and this plan also does not have any changes this year. This coverage includes glasses or contacts with a copay of $10 for a glasses exam and a copay of $25 for a contacts exam. The copays for your hardware for glasses is $25, and there is not a copay for your actual contacts. VSP provides you with a $150 allowance to purchase your glasses and an allowance of $130 for contacts. Please always contact VSP to ensure your physician and facility are in network. Short-term and long-term disability plans are offered by Unum at the employee's cost as protection from a loss of income should you become medically disabled. Short-term disability is paid out until the 12th week of your disability at 60% of your base income after a 2-week elimination period. And long-term disability is paid out starting the 12th week of your disability at 60% of your base income and until you are no longer disabled or reach Social Security age. Pre-existing conditions may not be covered, and pregnancy coverage is limited to 6 weeks for normal deliveries or 8 weeks for C-section deliveries, minus the 2-week elimination period. Free life insurance through MetLife is provided to all full-time employees and is a policy worth 1 times your annual salary. Employees can elect to purchase additional life insurance for themselves, as well as purchase coverage for their spouse or domestic partner and dependent children under the age of 26. If you want to increase your current levels of voluntary additional coverages, you will be required to complete a health assessment questionnaire. The rates to purchase additional life insurance can be located in your benefits guide. The next benefit available to you is the FSA account. A flexible spending account allows employees to set aside a portion of their paycheck for medical expenses on a pre-tax basis. Some qualifying expenses that these funds can be used for would include deductibles, copays, prescription copays, and glasses. Your benefits guide includes an extensive list of qualifying expenses. You are able to contribute up to $2,550 annually into the FSA account and $5,000 into the dependent care account, and the annual amount you elect will be divided amongst 26 payroll deductions. The annual amount you elect for the FSA account will be available for use January 1st with a MasterCard. You must spend all of these funds prior to December 31st, 2016, otherwise you will lose any remaining money in this account. For those of you who still have funds remaining in this account for this year, another way you can use these funds is to visit drugstore.com and shop in the FSA store on their website. A pre-tax dependent care account is also available for qualifying child care expenses. Funds contributed into this account via payroll deduction are not available up front and are only reimbursed after payment is made for child care expenses. This concludes the presentation for your open enrollment, and you are now ready to make your benefit elections for 2016. You will be making your elections online in UltiPro, or if you do not have easy access to a computer, you are welcome to come to the GCC or GRC on November 16th and 17th, and we can assist you with your online elections. As a reminder, your deadline to make your elections is November 22nd, even if you do not want to elect any benefits or make changes. The benefits you elect will start on January 1st. As a reminder, if you do elect a medical plan, in order to receive the lowest cost possible, you must obtain your wellness exam, not use tobacco, and submit those forms to your benefits department by January 24th. If you encounter issues when electing your benefits online, please feel free to call your benefits contacts listed on this page. Thank you and enjoy the rest of your day.